My name is Beatriz Martinez Flores. I'm a current first-year medical student here at the CUNY School of Medicine, and today I'm presenting my data from a study I did at Ocean Road Cancer Institute during my 6-week research visit in Tanzania. Now, Ocean Road is the only comprehensive cancer center in Tanzania and is located in Dar es Salaam. Over a 16-year span, there has been changes in Tanzania regarding HIV treatment. Patients now live longer because of greater access to HIV treatment, which has also increased the risk of cancer development. The research that I conducted investigates this and builds on a study that our previous C students did during the periods of 2002 to 2012 and 2013 to 2018. So this is a picture of the global prevalence of HIV. Globally, 36.9 million individuals live with HIV by the end of 2017. And as seen in this map, the darker colored areas have a higher prevalence of HIV infections. And as seen, Sub-Saharan Africa is affected by makes up more than two-thirds of the HIV population in the world as of 2017. Okay. Now, specifically in Sub-Saharan Africa, eastern and southern regions of Africa are the most impacted by the HIV epidemic. The image on the left shows where Tanzania stands. In relation to other eastern and southern African countries in 2017. And as you can see, the boxed area represents where Tanzania is with respect to the Eastern African countries. And as can seen, it has the greatest percentage of HIV infections in 2017. Now the map on the right shows the distribution of HIV infections throughout Tanzania. And as can seen, the darker areas have the higher prevalence of HIV infections, while the lighter colored areas are of lesser prevalence. So it's seen that there's a great distribution of HIV infection throughout Tanzania, with some being affected as little as 0.3% to the largest having a prevalence of 11.4% over here. Now, although Tanzania is the most affected region in Africa, in Eastern Africa, the life expectancy of those living with infection has increased over the years. With the introduction of antiretroviral therapy in the early 2000s, the life expectancy has increased. So from 1950, there was an increase from 40 years of life to 2015, which is now about 65 years. Yeah. Okay. So although the life expectancy of those affected with HIV has increased, there has been a similar pattern in increase of cancer risk development. So, So, as you can see, HIV immunosuppression causes those who are infected to be immunosuppressed, so therefore leaving them prone to viral infections such as that of the human papillomavirus. And as can see here, HPV leads to the accumulation of genetic mutations leading to precancerous cells, and then further leading on to cancer cells and malignant cells. Okay. So the types of cancers, specifically those of the squamous cell carcinoma that result from HPV infections, are shown here. Although cervical cancer affects many women in Tanzania, there has been an increase in other cancers such as that of the anus, vulva, and vagina in Tanzania. So this can be related to the increase in HIV life expectancy, which leads these individuals prone to such infections, thus leading to a greater chance of cancer development. So, interestingly, the distribution of anogenital cancers throughout the world as of 2018 shares a similar pattern to that of HIV infections. As can be seen here in the map, those with darker colored have a higher prevalence of anogenital cancers. So again, this area over here, which is part of Sub-Saharan Africa, has a heavy color, therefore meaning it has a higher incidence of anogenital cancers. which mirrors that of what the Ministry of Health in Tanzania had explained. Okay, so to look at this, the aim of my study was to compare the proportions of anal, vaginal, and vulvar cancers in relation to all cancers at Ocean Road Cancer Institute over a 16-year period, working from a previous period studied by Claire Miernick to a more recent period that I did for 2013 to 2018. My other aim was to determine and qualify epidemiological factors related to these cancers and to hopefully develop prevention interventions in the future. A study conducted by IARC previously determined the prevalence of HPV genotypes in different anogenital cancers, but failed to include Tanzania among the African countries. So I am concentrating on cancers of the anus, vagina, and vulva because of the hopeful initiation of HPV vaccinations in Tanzania. These cancers are important because if these cancers are eliminated, then there will result in an overall reduction in cancer cases. Okay. So as stated previously, Ocean Road is the only comprehensive cancer center in Tanzania, located in Dar es Salaam. It thus receives patients from different areas of Tanzania. In total, there's an average of about 3,000 cases of cancer diagnosed annually, which is hand-recorded in the logbooks, like the one seen down here. Hand-recorded, so they're not in the best conditions many of the times. So during my visit, I looked at these logbooks and used them to identify the desired medical records that I needed. So like I said previously, I'm building upon that of a previous study done. So for the years of 2002 to 2012, I used the data abstracted by Claire Miernick to identify the squamous cell carcinomas diagnosed at Ocean Road during this time period. I then abstracted the medical records and got the desired variables. In addition, because Miernick did not include vaginal or vulvar cancers in her study, identified these in the logbooks, but the medical records were not able to be used because they were not found in the hospital. So in addition, for the more recent period of 2013 to 2018, annual cancer case logbooks for these years were reviewed for the total number of anal, vaginal, and vulvar squamous cell carcinomas diagnosed at Ocean Road. So the total number of cancers diagnosed per year were also subtracted to calculate the annual proportion of each cancer identified during my six-year period. Corresponding to the annual logbooks, the existing medical records of all the patients diagnosed at Ocean Road during this period were identified, retrieved, and the desired variables were abstracted. So, from 2002 to 2018, the number of anal, vaginal, and vulvar cancers diagnosed in Ocean Road has increased. Really is in here. Specifically between the years of 2015 and 2016. And the biggest growth was seen in anal cancers, as seen in blue, where is it? Right here, where it increased 5 times its original proportion from 0.1% to 0.7%. And vulvar cancer, which is colored in green, right over here, which has increased 3 times from 0.2% to 0.5%. Now, although the overall cancers diagnosed in ORCI has increased over the recent years, even if the number of anogenital cancers, although it was small, increased, this proportion may have been lost due to the overall increase in diagnosed cancers at the hospital. But with the increase in total cancers and anogenital cancers, it still shows a significant increase since 2002. So, looking at the different, within the years of 2013 and 2018, which is the more recent period I looked at, the age distribution for the different squamous cell carcinomas were described. As can seen, the anal cancers seen in blue, and the vulvar cancer seen in green, over here, were diagnosed with patients between the ages of 40 to 49 years of age, while vaginal cancer seen in black, in the black bar, were diagnosed in a later year, 50 to 59. Interestingly, the ages of the diagnosed anal and vulvar cancers were younger than that of previous literature, which found that many patients were typically from aged 50 to 69 years of age. Okay. In addition, it was seen that many diagnosed with squamous cell carcinomas between the same recent time period resided outside of Dar es Salaam, averaging about 70% for each cancer for the year, as seen in the gray bars. Therefore, the patients diagnosed at Ocean Road were not natural residents of the area, emphasizing the possibility that the residents had easier access to adequate prevention, therefore reducing their amounts of diagnosis. Most of the patients that were diagnosed with anal, seen in the blue, and vulvar cancers were also seen to have a higher chance of having HIV infections. However, those diagnosed with vaginal squamous cell carcinoma were more likely to have a negative HIV infection. Now, this might be because of the small number of vaginal diagnoses done throughout this time period of 2013 to 2018. So comparatively, looking at what Claire had looked at from 2002 to 2012, and the more recent period that I did from 2013 to 2018. Oh, well, it didn't change. Sorry, the slide is changing on my laptop, but not on the screen. Do you want me to keep going? No, I can keep going, but.
Let's just start it over. It's not advancing up there. Okay. Let's try that again.
Okay, so comparing my more recent time period of 2013 to 2018 to that of Claire Miernick's from 2002 to 2012, her period was seen in blue, and mine was in gray. There has been seen an increase in diagnosis in Ocean Road for anal and vulvar cancer, although there's a very small difference in increase in vaginal cancers. Overall, it follows the same trend that was seen throughout Africa. Yeah. Okay, similarly, the proportion of those infected with HIV infection was observed too. And as stated before, I was only able to compare anal cancers because the medical records for vaginal and vulvar cancers were not found. So between the periods of 2002 to 2012, it was seen that 22% were infected with HIV, while in the later period, it grew to 38%. Now, this may be due to the more readily accessibility to HIV treatment throughout Tanzania, but it could also be due to the increase in HIV surveillance throughout the country, since the amount of missing HIV diagnosis decreased from 67% to 35% throughout the years. Okay. And also, so among those diagnosed with anal squamous cell carcinoma, there was an observable sex distribution. A majority of those diagnosed with anal squamous cell carcinoma were female, as seen in the gray, 79% and 65%. And although there was a proportional decrease throughout the years, it was seen that still more than 50% of females were diagnosed with cancer, were still diagnosed with anal squamous cell carcinoma. And because of this, although it is not known if HPV has a direct relationship to this, because of the known causal relationship from previous literature that it has to the development of these cancers, it may be due to. Okay. Yeah. Now, the prevalence of HIV in Ocean Road in between the time periods has increased, as stated previously, and the change was seen in the regional distribution as well. As you can see, more regions over here were affected. And because of the growth and distribution, it also now coincidentally mirrors that of regional distribution seen by the Ministry of Health in 2017, indicating that there's a possible improvement in HIV surveillance throughout Ocean Road, with its greater percentage of those being affected, as well as those, the distribution mirroring that seen by the government. So the increase in proportional anal squamous cell carcinoma, along with HIV infection, there's a possibility that this can be due to viral infections. And although it is not known if these individuals in this study were infected with HPV, further testing can be done to analyze the genotype. Yep. So, to summarize, an overall increase in proportional anal genital cancers of the anus, vagina, and vulva were observed since 2002, mirroring the records that has been seen. So, a majority of those diagnosed cases at Ocean Road were residents from outside of Dar es Salaam. This may be due to the fact that residents have easier access to care and prevention at ORCI, and this highlights the importance of the development of preventative measures to those living outside of Dar es Salaam who may not have easy access to cancer care. Yes. Oh, sorry. Yeah. So also, females were the most likely to be affected by diagnosed with anal squamous cell carcinomas, as well as be infected with HIV, emphasizing a possible room for intervention among these cancers that affect females. Yeah. So, because HPV shares a causal relationship with the anal genital cancers that I had testing to analyze the HPV genotype of the cancer tumors diagnosed at Ocean Road can show a possible connection between the anal genital cancers diagnosed with the viral infection. With this, it can help develop HPV vaccination interventions for at-risk populations, such as those infected with HIV, along with the overall general population in Tanzania. This will ultimately, these two ultimate implementations and strategies could be used to prevent cancer in Tanzania, and will hopefully reduce the total number of cancers, not only in Tanzania, but in sub-Saharan Africa. So, learning experience. This was my first time being a principal investigator of my own research project, so I learned how to conduct a research from start to finish. I was also able to learn how to work with a research team with our on-site director, Dr. Masami. She helped me network and be able to get in contact with people who could help me further get all my data and all the information I needed for my project. I also learned a lot of problem-solving skills, as a lot of the medical records were missing, and I had to supplement some information from other resources. And also with that, I also learned about the culture, being able to visit and how the healthcare system is different than that of here of the United States. So particularly, we were able to visit different healthcare settings, such as Amana Hospital and Mukuranga Hospital, and seeing the different resources that they have and available to those of Tanzania. It was able to show me new opportunities and different practices that I could use to hopefully implement in my own service and practice in the future to bring about community awareness for prevention and for different conditions. So besides work, we also found time to explore the rest of Tanzania. We did go to Zanzibar Island, and we also went to Idzunga Mountain National Park, so we did our hiking trip, as well as our short safari trip towards the end of our stay. Yeah. And so my acknowledgements, I would like to thank Dr. Solomon for giving me the chance to do this project, the CUNY School of Medicine, Mac Lipkin Fellowship for funding it, as well as Dr. Masami, Dr. Kahesa, Dr. Musalagi, and the other staff at ORCI for helping me finish this project, as well as my colleagues from the CUNY School of Medicine and CEAS program that were there during my time, who helped me out with everything. And yeah, thank you.